Hello everyone, I am Dr. Agwin. In this video, we're going to see about what are clear aligner, comparison between fixed orthodontic therapy and clear aligner, uses of clear aligner, how it's work, how long we should wear it, how should take care of clear aligner, what are the post-operative care should follow, and cost of clear aligner. Let's get into the video. Everyone wants a great smile, so the demand for aesthetic treatment is increasing day by day. More people are seeking alternative to fixed orthodontic appliance. For these people, clear aligner, which is also called as invisible aligner, are an aesthetic and comfortable option for orthodontic therapy. Clear aligners are transparent tray made of special material which are used to straighten teeth just like braces. Let's see the comparison between fixed orthodontic therapy and clear aligners. Fixed orthodontic therapy, which is painful, visible, not removable, foot restriction, difficult to maintain the oral hygiene, should undergo regular clinical visit, and the results cannot be visualized. But the clear aligners are totally opposite to fixed orthodontic therapy. They are painless, invisible, removable, no food restriction, easy to maintain the oral hygiene, no or minimum clinical visit. The result can be visualized with the visual smile plan, take less time than the traditional braces, fit smoothly on the teeth. Uses of clear aligners. Used to treat teeth gaps, crowding, forwardly placed teeth. Crossbite is a condition when the upper teeth fit behind the lower teeth when your mouth is closed or at rest. Used to correct open bite is a condition when the upper and lower front teeth slant outward and do not touch when mouth is closed. Correction of overbite. It occurs when the upper front teeth excessively overlap the lower front teeth when the mouth is closed. It also used to correct misaligned primary or the baby teeth of children between 6 and 10 years of age. Let's see how it works. Aligner trays are custom made for every patient depending on the severity of teeth misalignment. Based on the severity of malalignment, the treatment plan varies. After the proper diagnosis and you are the eligible candidate for using the clear aligners for correction of malaligned teeth, then the next step of aligner preparation will start. Teeth impression are made using 3D technology, then the digital models are transferred to production facility and the aligners are made. They provide multiple sets of approximately 25 to 40 sets of aligner for complete alignment of teeth. How long should wear aligners? For effective teeth straightening, you must wear them for about 20 to 22 hours per day and should change the aligner tray every 1 to 3 weeks. Multiple sets of aligner are used because a single aligner is only capable of moving teeth slightly for about 1 millimeter or less. Each set of aligner will slowly move the teeth into the correct position. Treatment can take anywhere between 3 and 24 months. How should take care of clear aligners? Should remove your aligner while brushing, flossing and eating. Keep your aligners clean. While you brush, make sure that you brush your aligner in the same way. Keep them safe in the box as given by your orthodontist to prevent it from getting dirty. What are post-treatment care you should follow? Retain your smile with retainer. Just because you have got your teeth straightened does not necessarily mean that it will stay straight throughout. Your orthodontist might advise retainer, which will prevent your teeth to shift back to their previous location. Take care of your food habit because your teeth are sensitive after the treatment. Therefore, it is advised to not consume too crunchy food for a few days. Don't forget to brush twice daily and floss your teeth. Visit your dentist every 6 months. Let's see the cost of clear aligners. The starting rate of clear aligners is about 45,000 in India and it varies depending on the alignment of teeth. The cost of treatment is determined by variety of criteria including intricacy of case, number of improvements required and number of aligner use.